stopped pumping, so there's no vacuum created.
When did that stop?
Stopped yesterday. But as the doctor just had a look, and he said there's no need to take this off, which I was concerned about because I'd heard about infection with these vacuum ones not working. But the bandage itself is intact, which is good. So they're going to snip that off, and
That'll be good.
it will, because stop it hanging around. And they'll still come back in 3 days' time to get taken off.
Just for fun.
Just for fun.
You walked all the way from the car park today just with one crutch.
I did, yeah. I'm quite good now with it. So as you can see,
Wow.
I've got
Don't overdo it.
great extension on it.
That's
I'm very
good.
pleased with my progress for my age group.
Excellent. So we'll see you back here Thursday.
Back at the Australian Open next year.
Yeah, sure.
And more to day 12's progression. We're walking on one crutch only as support. We've been doing that, well, I've been doing that for the last 2 days, finding it okay to get around just on a single crutch. Makes life a little bit easier, less things to carry around with you when you're in the car and so forth. The pain levels are dropping right down as far, there's only a bit of stiffening in the muscle still, but that's about the only pain factor. Jarring it when standing up is also a little bit of an issue, just to make sure that you do have your balance correct, and not forcing the knee too much forward. That's about the only other pain situation that I've encountered. And as far as medications are going, I've almost run the complete course of all of them, with the exception of aspirin, which I have to maintain for a number of weeks for the in case of blood clots, which I doubt I'm going to get at this stage because I am fairly active with the leg and moving around quite nicely. So antibiotics, we still have a number of those to run, and basically Panadol is the main source of pain relief, although I'm not too sure exactly what it does. However, the nurse said it's more of a background pain relief, but I'm not sure what sort of pain I've got in the background. So there we go. So we're nearly out of tablets, and that's after 2 weeks. We'll be pretty much off all tablets bar the aspirin.
Hi, Derek. Where are we? What are we doing?
We're back in the RGH for my 14-day check.
14 days already.
14 days already.
Wow.
So we've done the 2 weeks, and still got the one crutch just in case. Getting up on 2 legs by myself is possible these days, but I need to be careful that I've got something close by just in case to hang on to. So when we go out, we have a crutch. We're having a coffee just before we go into the outpatients.
They have nice things at this little kiosk.
All volunteer run cafe.
A lovely cafe.
It is.
And everything's lovely and clean and... Go on, you're right. Do you think you might lose the big bandage today?
Well, we think we might lose the bandage today. This was the vacuum assisted negative pressure bandage that had the pump, which gave up on me. And they took that off and they sealed the access for the actual pump through the bandage to stop infection.
Right, so you've lost the vacuum pump.
We've lost the vacuum pump, part of it. So it might be coming off today because I think it has pretty much dried up. But it does feel quite safe when I've got the bandage on because it is quite fat, I suppose you could call it.
Still swollen.
It's a sponge bandage,
Yeah.
and so it does provide a little bit of mental protection.
Let's have a look at that bandage. See where we're at. Oh, tiny bit of
Yeah,
old
it started,
leakage.
because there's no vacuum left in it, you can see it starting to lift.
Yeah. Oh well, you might lose it today.
So that might might come off today.
You never know your luck.
You never know your luck. So we'll see Dr. Nick.
There's a really nice gift shop here too, and they've got beautiful handbags. Do you want to buy me
Which
one?
I'm not going to buy for you. No.
What?
As
the
much
way-
as I would love to get
on
you
the
one
way
for
out,
all your
maybe.
help and assistance.
And petrol money?
Yeah.
Oh yeah, maybe we could get one on the way out. We'll have a look.
We'll discuss the finances later.
You're going. So this is the corridor up to the outpatient clinic where he has to go for checkup. And there's also oncology and all sorts of things up here. Sad place to be, really. Okay, so what's happening now?
We have returned from the hospital,
Yeah.
outpatients, after hopefully, well, we were going to see Dr. Nick, who's the registrar of the outpatients, but however, he was not in because doctors always turn up late. So we only saw the plaster room nurse from South Africa, she is, and she changed the dressing, the vacuum assisted dressing, to just a flat waterproof dressing. However, she put this tape on the side just to assist it, and that has stuck onto the waterproof section, and it's starting to peel that off. So she said you can take that off after 2 or 3 days. However, if I take that off, it's going to take that whole strip off as well. So I'm not too sure about their bandaging techniques in the plaster room.
Anyway, so it's feeling okay
It's
though?
feeling okay. I was starting to feel a bit of an ache in the leg from standing for that fairly lengthy period. However, we've come home, we've done a bit of ice therapy on the top and on the bottom, which feels good because it just takes the pain away.
And some painkillers.
And some painkillers which haven't really kicked in yet, but it's obviously now 2 weeks yet. We've done 14 days since surgery. Walking on it okay. I'm pretty well, that's about as straight as I can get it, which is probably not quite as pronounced as the other leg. But
Not too bad,
it's still not too bad. In the walking position, you can't really tell that it's anything wrong with it. It does bend, the bandage is a bit tight, it does bend a little bit more than 90 degrees now. As you can see, I've got about 85 degrees on there. It does take a little bit out of the muscles to do that. Swelling on the calf area has pretty much gone, but there's still definite swelling around the actual knee area where the new implant is, and up here where the quads are still trying to repair themselves. So most of the pain is generated from the quadricep area and to this area around where the actual joint is. But by and large, it's not too bad, I suppose.
And the most important thing of all, did we go to the shop and buy a handbag?
Yes, I did end up buying you that handbag.
It's beautiful, and it was such a bargain.
And it worked out that it was a complete set of handbags.
For 4 different things.
There was a purse, there was a small carry bag, there was an in-between size carry bag, then there was a shoulder bag.
It was amazing. Thank you.
And
I deserve it.
and you're going to pay me back,
Oh,
apparently.
we'll see about that.
This is now 3 weeks post-surgery. We've got all dressings off. That's healing quite nicely. The areas of pain are generally behind the knee, still in the quadricep up here. Down here is the numbest part, and on that side is probably the most painful. which is you can feel it through the bone. Obviously there's bone trauma through there, but the rest of it is swollen still a fair amount of swelling around this area. The quad is still sore, and that hurts during bending processes, but by and large it's not too bad. It gets iced quite frequently to try and reduce this swelling. The swelling in the calf is pretty much gone. Painkillers are still just down to Panadol. I've had the odd one every now and again when I've felt that I'm going to get a bad night's sleep, so just to help with getting some sleep, but mostly it's been okay. It's still slow to obviously move it, but I'm walking around without any aids at the moment, and I've got physio coming up at the 4-week mark, so we'll be looking forward to that and see what that can do. Good morning. We have a progress report on my total knee reconstruction surgery and how it's progressing. It's now been about 4 weeks since the surgery. Had my first physio appointment a day or so ago, and he was rather impressed with how it's all proceeding. I've got quite a bit of flexibility. I'm up to about 115 degrees, but I think I've improved on that a little bit more since with the exercises I've been doing. So I'll give you a little bit of a demonstration of what I'm capable of doing. I've been walking without assistance or crutches for the best part of 2 weeks. Every now and again I might need a little bit of a help when I'm not feeling too comfortable, but as far as bending the knee goes, here's my little exercise. I can get right down onto there, so that's not too bad. And we do this a number of times. Now don't forget, this is only after 4 weeks, so not too bad. There's slight aches, but not too much pain. Night time is about the worst because you focus more on the actual knee itself, so you do tend to focus more on the aches and pains. I don't take any pain medication any longer. At the moment it's pretty much a day-by-day proposition as to how much you improve. I can feel slight improvements daily, I would say. I get to walk around the garden a little bit and do my stretching exercises. It aches for a little bit after that, but then it's fine, it's pretty good. Still continuing with the ice packs to get the swelling down. There's still a fair amount of swelling left around the kneecap, which is understandable. The scarring is healing up quite nicely, and all in all it's not bad progress so far. So I've got to get the other knee reconstructed after this one, so we're going to give it about 3 months or so, if not a little bit longer, to fully get used to having the knee. It's a little bit different, you can feel a little bit different, but by and large there's no pain as to what I was experiencing through the osteoarthritis, and which I've still got in the other knee. So doing some of the bending exercises with both legs, I can feel it more in my bad leg, which is now my right leg, and that sort of tends to prevent me from doing full bends, but if I'm doing a single leg bend as I did on the steps there, that's not too bad. It's actually no actual arthritic pain as such. So we're going well. Now we will be going back to Bali in, what have we got now, about another 2.5 months. So the idea was to get at least one knee done prior to that, and hopefully it was good enough to be able to walk around Bali, as you do. You do quite a fair amount of walking, or we do at least. And so I think I'm on track that it's going to be okay for the upcoming trip, which is what we've always planned on doing. We thought we'd have the surgery giving us enough time, or giving me enough time to fully recuperate the leg. And the way I'm going at the moment, after 4 weeks, I think I'm well on track. So Bali, here we come. And so far, the scar, as we can see, quite narrow, but there's still a few lumpy bits due to still some swelling. Swelling is over here and across here still. But however, we'll be seeing the doctor today, and it's probably going to be the sign-off for this particular operation. Maybe discuss when the next knee is to be operated on, but I don't think that's going to be for another few months yet. And also we'll be finding out if I can officially drive again. And even though it was the left knee that was operated on, there's not a great impact on an automatic vehicle, so I'm not sure why I couldn't have driven in the first place. But I did the right thing, and I took their advice not to drive for 6 weeks. So let's have a look and see what happens when I meet the doctor.
I am the chauffeur, and I am not happy that I've driven all the way to the hospital to be told it's cancelled. Could have told us earlier, and now we're driving home again, and I'm still not happy.
My chauffeur wasn't very happy about having to drive me to the hospital, only to find out that it's been cancelled. No reason really given, but oh well, what can you do? And so I got a message probably about a minute later, SMS message saying your appointment has been rescheduled for 2 months down the track. So that'll be about 4 days before we leave to go on our next Bali trip. So I think I'm going to be ready and good to go, so no problem with me getting around the streets of Bali, the beaches, climbing temples and so forth. So I think we've made it so far that there's not going to be any hindrance at all by this knee operation in me getting back to Bali. So all is very good, and I'm enjoying the blue skies here at the moment, and yeah, can't wait to get back. So here we are 50 days in post-op, and the results so far seem quite good. The swelling is going down, it's still there, but it is still going down, and I can feel the knee starting to loosen up, in particular the kneecap, which does unfortunately clunk a little bit, not all the time, and I've got to work out my walking situation, I think, to overcome that. And also I've still got to build up the quadriceps and the ligaments from the quads that hold the kneecap in position. So all in all, going along quite well. The pain at the back of the knee that I was experiencing, the ache, is by nowhere near as severe as what it was, or as irritating as it was. There is still an ache through the knee, and that's understandable. If I go walking for an extended period of time, particularly if I'm taking small steps, say for example we went out to a theatre the other night, and you're in the hustle and bustle of a lot of people, and if you're taking small steps, I found that quite uncomfortable. But if I'm taking long normal strides, it feels quite good overall. I'm also at the point where I can kneel tentatively on it, and getting up is still a problem because the other knee is not really cooperating all that well. And once we have that done, I might be in a better position, say 6 months or 9 months down the track, to be in a position where I've got the mobility and freedom that I used to have way before the osteoarthritis kicked in. And I'm hopeful of that. I'm really hopeful that that is going to happen, but that's my case. It could be different for anybody else. So in summary, after 50 days you should have quite a fair amount of mobility. You won't be relying on crutches, canes, walking sticks or walkers. However, you will probably get a little bit of tiredness in that leg. You will notice that it may ache. So just be aware of that. Take it easy. If you are wishing to proceed with a total knee replacement, I would say it's going to be a fairly good thing that you do. I don't have any regrets at this point. It's still early days. I mean, I've still got a long way to go and I've got another leg to get through. But after 50 days, I'm feeling that yes, I'm seeing light at the end of the tunnel. So I wish you all the best if you do proceed with the total knee replacement, and thank you very much for watching. Thanks for watching our videos.
Please like and share them.
Also, please leave a comment.
And most importantly,
Don't forget to subscribe.
We would really appreciate your support.